like to apologise to anyone who has had any appointments or operations cancelled today. It didn't need to come to this. We have been requesting the government to discuss junior doctors' pay for over 2 years. Junior doctors have suffered a real terms pay cut of more than a quarter over the last 15 years, and the government has refused to make an appropriate offer for us to call off this industrial action. So after studying for at least 5 years at university, a doctor graduating with more than £100,000 of debt is paid £14 an hour, and we don't think that's good enough. This request is to restore pay to 2008 levels, which is only a fiver. So what we're asking for is for junior doctors' pay to rise from £14 to £19 an hour. So that is a fiver that this government doesn't think that doctors are worth. Everyone is burnt out and feeling undervalued. After years of austerity, a pandemic, and now a cost of living crisis, graduating with such staggering levels of debt, being unable to afford rent and childcare, and I think it's unacceptable that doctors in 2023 in England are also unable to pay for rent and childcare. It's an absolute disgrace that a doctor cannot pay for such things. We are seeing doctors leaving the NHS in their droves. I graduated almost 10 years ago, and in my cohort 1 in 5 doctors went abroad. Now it's 2 in 5 doctors, and we're seeing even more doctors wanting to leave the NHS and work elsewhere. The public understand the role of the junior doctor. They see us when they enter the hospital. We are the first people that patients interact with when they come to hospital. We see them in A&E, we see them in the outpatients clinics. They see us on the wards and they understand the stress that we are under. The patients' lives are put at risk every day because there aren't enough staff in the NHS. But during the course of these strikes, there are consultants and there are specialists who are still looking after patients on the wards. Unfortunately, it has meant that planned activities such as outpatients appointments and elective surgeries have been postponed because of this action. But that emergency, urgent and critical care is still being delivered by the most senior doctors in our hospitals.